Hello, my name's Sanj Kakar. I'm a consultant hand and wrist surgeon here at Mayo Clinic, and today we'll be talking about ulnar-sided wrist pain. So what is ulnar-sided wrist pain? Well, it's often known as the black box of the wrist, and what we're talking about is we are talking about this area here of the wrist, on the outside of the wrist here. This is like back pain, for example. There's a lot of diagnoses here, and it's a very, very common symptom that patients have where their wrist is hurting and it's difficult to know what's going on. There are a lot of structures in this area, and it's important when you're going through this to see a hand surgeon that is competent in this area and treats a lot of these conditions. There are many causes for this. For example, one of the causes is if you look at the back of your wrist, you have this little knobbly bone. This is called the distal ulnar, which normally, if you look at the back of your own wrist, sticks out facing towards you. Sometimes this area can be injured, for example, in a fall where you've sprained your wrist. And when you're moving your wrist, especially when you're twisting, you notice pain on this area here. Sometimes you may have broken your wrist in the past and it was treated, but you may have had a fracture in that area where it didn't set right and the cartilage was injured and you get arthritis. And this is called distal radial ulnar joint arthritis. There are many treatments for this. Simple treatments, for example, a splint, over-the-counter oral medications that one can take. In addition, one may need an injection in this area of local anesthesia and steroid, and that may help calm down your symptoms. Eventually, however, if the pain does get worse and is not correctable with these medications, if you do have arthritis, there are numerous surgical procedures out there. So I think if you do have this condition, it's something that you shouldn't lose heart over. There are treatments for this. Sometimes this bone can be unstable. As we talked about, when you're moving it, it flops back and forth, and sometimes you can feel a clunk. You can maybe even hear that clunk, and that's where that joint is unstable. In addition to simple remedies such as a splint, one may be able to use that. There are muscles and ligaments and tendons that you can strengthen doing therapy, but if that doesn't help you, then there are certain stabilization surgical procedures that can be done to stabilize that. Another common area of wrist pain is just in this area here, what we call the TFCC. And this is commonly seen in patients, for example, playing a lot of sports, tennis, golf, where there's a lot of violent twisting. And what can happen is that these patients are very tender right in this area. In fact, you may be able to feel on your wrist, if you press in that area, that reproduces your pain. There are many structures in this area, many ligaments that insert in this area. And so the treatment for this are simple things, for example, a wrist splint. Just back off if you've injured your wrist a week ago playing tennis. Take some time off, take some anti-inflammatory medications. A compression wrap, a bandage may help you. However, if it continues to bother you, I think it's important to see your local hand surgeon. Usually when we see patients with this, we start off with a good clinical exam, and as we say, we press right here, and most of the time patients will say, "That's right it, doc, that's where it hurts." And so the other tests that one can do is get an X-ray to make sure there's not a fracture, but usually we would get an MRI scan, and the MRI scan is actually very good in showing if a tear has happened. Now, if this tear has recently happened, we can treat these, for example, in a cast up to about 6 weeks to try and let this area calm down, and for patients then to do therapy. Sometimes, however, patients don't get better in a cast, and sometimes what we need to do is go to the operating room and we put a small camera into the joint called an arthroscopy, and that will allow us to actually see the tear, diagnose the tear, and fortunately now with modern surgical techniques we can repair these. Patients do very well. They are in a cast for about 6 weeks, and then after therapy for about 4 weeks or so they slowly regain strength and function, and usually that gets much, much better. Another cause of ulnar-sided wrist pain is, for example, when you're twisting or moving the wrist from side to side. And what can sometimes happen is that this knobbly bone here can sometimes hit one of the wrist bones here, and that's called ulnar impaction. Sometimes God has made us in such a way that this knobbly bone is a little bit longer in you, say, than somebody else, and so you're sort of set up for this condition to happen. But it can happen, for example, if you break your wrist. If you break your wrist, for example, with this bone setting in the wrong position, suddenly that outside bone is a little bit more proud, and that can be hitting the wrist bone when you're moving it from side to side. Treatment for this, simple remedies, for example, a splint and an injection may help. They're commonly diagnosed with an X-ray where you can sometimes see the bone hitting the other bone. You can also get an MRI scan which nicely shows it. However, if non-operative treatment is not helping you, things that we can do, for example, are putting a camera into the wrist joint and just shaving down that piece of bone so it's not hitting that bone, and so by shortening that, it takes away the pain. In addition, what we can also do is we sometimes make an incision on the outside of the bone here, and we actually shorten the bone down and hold it with plate and screws, and in that way we've shortened the bone such it's not hitting the other side of the bone. In addition, don't forget, apart from bony injuries, there are a lot of tendons around the back of your wrist. For example, when you're moving your fingers back and forth, these are the ropes that allow you to move your fingers. There are certain conditions, for example, you may have injured yourself in twisting, for example, tennis, golf, squash, where some of these tendons can become irritated and actually become loose, such that when you move your wrist from side to side, they flip over the bone. These patients can be diagnosed with a simple clinical examination, and certain studies such as an ultrasound or an MRI. If these injuries have happened recently, they can be treated in a cast for up to about 6 weeks. Sometimes it's a cast above your elbow to limit your ability to move your wrist, and it may settle down. A steroid injection may help. If that doesn't help, however, there are stabilization procedures one can do where we make an incision on the back of the wrist and we basically either reinforce the area that has been torn and repair it, or do a reconstruction with local tissue. Patients are in a cast for about anywhere from 4 to 6 weeks, and then they do a programmed course of hand therapy afterwards to regain their strength. So in summary, I would say that the ulnar wrist side, pain over on this side, is a complicated area, but don't lose heart, because there are numerous diagnoses of which we have excellent treatments that we can do in today's day and age to take care of this.